Tampa General Hospital's lung transplant program is unique in many respects. One important distinction is that it's run by Lung Associates, a private practice pulmonary group out of Tampa General Hospital. Lung Associates started in February of 2007 as a solo practice lung transplant program run by Dr. Mark Rolfe. Since that time, we've added two additional physicians, Dr. Haddad and Dr. Floreth. Our practice now concentrates on lung transplant, cystic fibrosis, and clinical research into end-stage lung diseases such as cystic fibrosis and pulmonary fibrosis. At the current time, we have no affiliation with the University of South Florida or its training programs, and we request that all referrals for lung transplant or care of cystic fibrosis and end-stage lung disease come directly to the lung transplant program at Tampa General Hospital. I'd like to take this opportunity to introduce you to our physicians. Dr. Mark Rolfe is the Medical Director of the Lung Transplant and Cystic Fibrosis programs at Tampa General Hospital. He was the initial pulmonologist involved in the formation of the lung transplant program and has been its program director since 1998. He completed his pulmonary and general medicine fellowships at the University of Michigan Hospitals in Ann Arbor, Michigan. He's an UNOS qualified lung transplant pulmonologist and has worked extensively in the cardiothoracic intensive care unit at Tampa General Hospital. He's a fellow of the American College of Chest Physicians, was UNOS Region 3 representative to the thoracic transplant programs between 2008 and 2010, has been voted Tampa Bay Metro Best Physicians from 2007 to 2013. He was an associate professor of internal medicine at USF from 1993 to 2007, when he broke away from the university to form Lung Associates. While at the university, he was a medical director of the ICU at Moffitt Cancer Center from 2000 to 2006 and a member of the thoracic oncology program at the Moffitt Cancer Center from 1995 to 2006. Dr. Tarik Haddad joined Lung Associates in 2008. He did his fellowship at Baylor College of Medicine and was a medical director and established a lung transplant program at Allegheny General Hospital between 2007 and 2008. He's an UNOS qualified pulmonary transplant physician, works extensively in the cardiothoracic intensive care unit at Tampa General Hospital, is a member of the Pulmonary Hypertension Association, the American Thoracic Society, and International Society for Heart and Lung Transplant. Dr. Tim Floreth is the newest member of Lung Associates, having joined in July of 2011. He did his fellowship at the University of Chicago, including an additional year directed towards lung transplant research. He's a board-certified internal medicine, pulmonary and critical care physician, and UNOS qualified pulmonary transplant physician. He's a member of the American College of Chest Physicians and a fellow of that organization. He also is a member of the American Thoracic Society and the International Society of Heart and Lung Transplants. Now a few facts about the lung transplant program at Tampa General Hospital. Tampa General Hospital's lung transplant program has averaged about 45 lung transplants a year for the last 4 years. This makes it one of the top 10 lung transplant programs in the country for volume. We have below national average wait times. We have 1 in 3 year survival statistics equal to or better than national average and comparable to any large volume program in the country. We have a higher percentage of older patients who undergo transplants, and because of our affiliation and association with a large cystic fibrosis program, having over 145 patients, we do a high percentage of cystic fibrosis patient transplants. We are the only private practice lung transplant program in the country. Lung Associates is heavily involved in the support of One Breath at a Time, our patient-run support group, who performs fundraising for patient support and clinical research into the issues associated with lung transplant. We have annual events including the annual Beach Bash, the annual Christmas party, an annual Scramble Golf Tournament, and an annual 5K run, all of which provide our funding for the support of this organization and its efforts. One Breath at a Time is a 501c3 not-for-profit charity organization. Members of this organization include the pre- and post-transplant patients from Tampa General Hospital, their families, and of course the physicians at Lung Associates and the coordinators from the lung transplant program at Tampa General Hospital. Testimony to the success of One Breath at a Time is the existence of the Butterfly House. This home was bought and paid for by proceeds from charity events and donations to One Breath at a Time. It's a respite away from the hospital for families and patients who are undergoing the transplant process or are returning for clinical visits and follow-up. Every spring, One Breath at a Time sponsors a picnic at Fort DeSoto. This is a family-oriented celebration of our patients' successes. The food for this event is paid for by New Lung Associates, including chicken breasts, bratwurst, hamburgers, and hot dogs. And the physicians of New Lung Associates man the grill to assure that this food is all prepared for the patients as they arrive. At the end of the event, we have a butterfly release to honor the memory of our donor families and the donors. Another highlight of the event is the annual Beach Bash picture. Here you see Dr. Rolfe, Haddad, and Floreth sitting in front of a group of patients who have participated in the picnic and are all recipients of lung transplants at Tampa General Hospital. The Beach Bash is a huge success every year. Many of the nurses who take care of the lung transplant patients at Tampa General Hospital and the staff will show up for the party. Families will show up for games. Of course, there's great food, and our newest transplant members get to participate for the first time in one of the events that is sponsored by New Lung Associates and One Breath at a Time. The patients and family look forward to the butterfly release every year. The sight of 50 to 100 butterflies being released by our transplant recipients every year is a sight to remember. Another very popular annual event is the Christmas party. It's one of the major fundraisers for One Breath at a Time, in which we perform auctions, raffles, Chinese auctions, and 50-50 giveaways. New Lung Associates deep fries and provides the turkeys for these events. At last year's Christmas party, over 150 pounds of deep fried turkey was consumed by the patients and their families. And of course, at the beginning of the event, we have our annual Christmas party picture. The picture here is from last year's party with our transplant recipients and physicians. A very popular event at the Christmas party is the annual raffle, where donated items are raffled off to the families at the party. The proceeds for this go to support the Butterfly Home, our home for transplant patients and their families. If you're not very lucky at the raffle, there is at least food, as every family will bring their favorite holiday dish to share with their fellow patients and families. Every fall, One Breath at a Time sponsors a golf tournament. This is a corporate sponsor and individual sponsored event and a major fundraiser for One Breath at a Time. This format is a scramble with skills awards for closest to the pin and longest drive, and at the end of your 18 holes there's a great raffle and a huge barbecue. It doesn't matter if you're a pro or a hacker who picks up his clubs once a year. It's a great event with a great time for a good cause. Every spring, One Breath at a Time and New Lung Associates sponsors a 5K run. It's a great way to try out new lungs and to test your skills against recent transplant patients. It's held at Al Lopez Park, and there's prizes for all age groups and a great post-run breakfast. The skill level at this run goes anywhere from people pushing 3-minute miles to people walking around and enjoying the great day. At the end of the event, ribbons are given out for first place finishers and various age groups and skill levels, and of course there's a great breakfast and fellowship with your fellow runners. The physicians at New Lung Associates are completely committed to the success of One Breath at a Time and our patients. For more information about New Lung Associates and our various events, you can go to our website at newlungassociates.com. There's extensive information about transplants, the staff and faculty of the lung transplant program at Tampa General Hospital, and links to important transplant sites and referral information.